Good evening. Welcome to the American Dance Therapy Association webinar, Credentialing and Licensure, Navigating the Profession of Dance Movement Therapy. We have assembled a panel of dance movement therapists representing the American Dance Therapy Association and the Dance Movement Therapy Certification Board to address this topic. In this panel webinar, you will be hearing from Margaret Migliorati, the President of the American Dance Therapy Association, Julie Miller, the Chair of the Dance Movement Therapy Certification Board, Dr. Beth Kalish, past ADTA President, Stacy McGinn-Hurst, Chair of the R-DMT Committee of the DMTCB, Joan Wittig, the Chairperson for the Standards and Ethics Committee, Dr. Charnay Furcron, the Chairperson for the Multicultural and Diversity Committee, and Ebony Nichols, the Liaison for the Multicultural Diversity Committee. My name is Laura Wilson, and I am the Continuing Education Manager of the ADTA. We are so glad that you are with us this evening. We've had a tremendous response. Nearly 350 people have registered to attend this evening's webinar, and we're glad you're here. The Continuing Education Manager position was created by the ADTA in 2019 as an investment in the development of innovative and diverse platforms for continuing education for our membership and our allied community. This webinar is an example of that exploration, our first foray, if you will, into presenting via new technology, namely Zoom webinars. So I'm really excited to have you be part of this pilot project as audience members, and I look forward to your feedback in the evaluation as to what you liked about this format and what you would like to see improved upon in future offerings. A few housekeeping matters before we get into the content of the webinar. This webinar is free to everyone. However, 1.5 ADTA CEs are available as a member benefit to all active ADTA members. To receive your CE certificate via email, simply fill out the evaluation form at the end of the webinar. When the Zoom window closes, you will automatically be directed to the survey. Once you have completed the evaluation, you will receive the CE certificate via email within 14 days. This webinar will also be made available for on-demand viewing on the ADTA website in the next few days. For those of you who are joining us in that manner, know that ADTA CEs are also available to you for on-demand viewing by simply completing a 5-question quiz and evaluation. The links for the quiz and the evaluation are positioned near the link to the webinar on the ADTA website. And there we have our first Zoom webinar glitch. So thank you for being a witness to my process. The presenters of this webinar do not have any financial arrangements related to the content of this activity to disclose. And now I would like to welcome Margaret Migliorati, ADTA President.
Thanks so much, Laura, and thank you for leading us into this brave new world of Zoom webinars. Welcome, everyone. I am thrilled that you are all here for this critical topic to discuss together credentialing, licensing, and the profession of ADTA. This webinar was born out of a recent Facebook discussion about the pros and cons of the ADTA credential, the R-DMT, and the BC-DMT. In the course of that Facebook exchange, some really important questions and concerns arose, and the ADTA board and the Dance Movement Therapy Certification Board decided to put together this webinar to try to begin to address some of those questions and concerns and to continue the conversation with you. It truly is our hope that this is the first step in ongoing discussions about the future of our profession, a future we all share and I think that we all care about deeply. Before we get into our topic tonight, I'd like to invite everyone to just take a moment to settle in. Maybe give ourselves a moment to arrive together through space and time, whether you're watching live or recorded. Perhaps get comfortable in your chair, wherever you're seated. Take a few deep breaths. And I invite you to think back to when you first learned that there was a profession called dance movement therapy. For unless you are a part of our first generation, there was a moment that each of us discovered that the profession of dance movement therapy and that the career path to becoming a dance movement therapist already existed. So take a moment to remember what that felt like to make that discovery, to realize this was a career you could actually pursue if you so chose to. And I invite you briefly to just explore in a gesture or movement what that discovery felt like for you. So just take a moment to explore that with a movement for yourself. As I was preparing for this and thinking back to my moment and starting my dance therapy training long ago in the 90s, the feeling for me was something like, ah! It was such an exciting revelation to realize this career existed. And I think for most of us who choose to become dance movement therapists, our choice is based in passion and a sense of purpose and calling. But we also know that passion and purpose are not the only sides of this career. That a career in dance movement therapy also requires patience and persistence and perseverance throughout our lives as forces that are larger than us, the larger society, larger healthcare system, constantly challenge us to respond, to adapt, and change. And so during this webinar, we will really be talking about that persistence and that perseverance and that practical side of what it means to be a DMT. But as we do that, I encourage you to really ground that in your movement, in your remembering and rebodying of your passion and your purpose, because truly both of those are required for a long-term, vibrant, happy career in DMT. So let's get started. Laura, if you can advance. These are our learning objectives for tonight. I'll give you a moment to read those. Okay, Laura. And this is our agenda for the evening. Go ahead and take a moment to read through that. I am thrilled to present our panel tonight, a panel that spans from our very first generations to our most recent graduates and everybody in between, and truly represents what it means to be a membership-run, membership-driven, membership-defined association. I think you're going to learn a lot from them. I know I will. So I'd like to begin our evening by introducing to you Julie Miller, Chair of the DMTCB.
Thank you, Margaret, and hi to everybody. So I'm going to start us off by talking about what does it mean to be a professional. I'm going to start with a couple of definitions. A paid occupation, especially one that involves prolonged training and a formal qualification. An occupation founded upon specialized educational training, the purpose of which is to supply disinterested objective counsel and service to others for a direct and definite compensation, wholly apart from expectation of other business gain. An occupation, practice, or vocation requiring mastery of a complex set of knowledge and skills through formal education and/or practical experience. Every organized profession is governed by its respective professional body. And every profession has its own internal structures that are meant to develop, promote, and safeguard the practice of the profession. And these include membership support. For us, the ADTA provides this membership support in the form of governance, advocacy, standards for training and practice to ensure the continuance of dance movement therapy, and to support the work of dance movement therapists around the country, and educational standards. Every profession needs to determine what its practitioners need to know and to assess how well training programs meet that goal. Thanks to Jessica Young, the Educational Standards Task Force, and the Education Committee, we now have a robust set of educational standards that identifies the areas of knowledge that we as dance movement therapists should share. Practice standards. When you've entered into the realm of professional practice, there's a set of guidelines for what's expected and required, as well as a scope of practice that we all need to adhere to. And ethical standards. In the field of mental health, ethical standards are in place to ensure that mental health professions do no harm to clients through misrepresentation or other breaches of ethical behavior within the therapeutic relationship. And finally, credentials, which is my bailiwick. This is an acknowledgement of a disinterested body that practitioners have attained the necessary training, practice, and supervision to provide services, either institutionally or independently. There's 3 levels of credentials for mental health practitioners: registry, certification, and licensure. So the registry first, it's simply a list of practitioners designated by a professional body that have been identified as having attained the requisite education and training to practice as a professional. Registry is generally not recognized outside the body that confers it. The second level, board certification. Board certifications existed in many different professions, most notably medicine. So you can remember when you go to the doctor, they have those certificates on the wall that say board certified, blah, blah, blah. And this involves an examination of some kind that assesses a person's mastery in specialty-specific processes. Often, doctors will be certified in family practice or OBGYN or another specialty. And later, Stacy's going to expand on the concept of certification when she talks about the reason for the change. But certification is recognized by the public as an acknowledgement of higher level or specialty training. The last level is licensure. And this is the highest level of credential, and it's conferred by states on mental health practitioners through examination and attainment of required employment and supervision. And it's a legally binding requirement to practice in the state. Licensure is the means for each state to provide the minimum protection to its citizens by ensuring that independent practitioners are prepared and able to provide ethically and knowledgeably informed service to the public. Our credentials process was conceived and developed by the ADTA during a time when DMT was new enough not to be recognized as a licensable profession. Since we weren't licensed, the founders of ADTA felt it was important to create our own structure for both acknowledgement of status and protection of the public. But over the past 20 years, licensure has become the standard for practice in most states. So the majority of dance therapists are now licensed either as dance therapists, as in Wisconsin, creative arts therapists, as in New York and New Jersey, and mental health counselors in most other states. In the light of licensure, the question arises, Why seek certification? Licensure is a legal requirement to practice. However, licensure, either as counselors or even creative arts therapists, does not focus on the specific skills of practicing dance movement therapy. The focus of those exams are on clinical skills, which of course are part of the work that we do. But how that manifests in a dance movement therapy session can be quite specific. In our case, certification, which is an assessment of a dance movement therapist's ability to use dance movement and body experience in a session, is a much more specific acknowledgement of expertise. But more importantly, it increases a sense of professional identity, both individually and collectively, which is very important, as Margaret said, because we face many obstacles to acceptance. How or why do we keep our professional identity despite the lack of public recognition? Because the work of dance movement therapists is unique, profound, and significant. And because we're up against an ingrained fear and suspicion of the body from employers and the public alike. We need to continue to identify what it means to be a dance movement therapist in both institutional and independent work settings, as a protection to the public and for a protection for ourselves as dance movement therapists, and most importantly, as a source of professional identity.
Thank you, Julie. And now we will hear from Beth Kalish, past ADTA president.
Hello. As the senior member of this group, going back to when dance therapy was not an organization, I want to be more personal and answer several questions about the history of the registry. And as I went over this material and thinking about presenting it to you today, I was very excited seeing our trajectory. Currently, I'm getting ready to celebrate my 87th birthday, and I started in dance therapy in my 20s. So I have a very long line here to communicate to you. And the history of the registry was primary from the beginning. If you can imagine, before there was an organization, 4 of us met in 1964. We were already practicing, some of us who had studied with Marion Chase, but we met in 1964 near St. Elizabeth's Hospital to talk about forming an organization and to convince Marion Chase that this was a great idea. She was opposed, violently opposed. So we had to be very strategic from the beginning. The 4 of us were second generation. We were not dancer performers like the first generation, like Marion Chase and Trudy Shoup and Mary Whitehouse and many others who were practicing dance therapy by the seat of their pants, so to speak, in those days. We decided we wanted an organization because the 4 of us had all been teachers of dance and were now acting as dance therapists after a very long 3-week course with Marion Chase. And we didn't feel like we knew very much. And the fact is we did not. From the beginning of our meeting in 1964, we realized that we were novices as a potential organization, but we felt immediately that we needed to set standards for professional identity. questionnaires were sent many, many times to anybody who said they were doing, quote, dance therapy in a psychiatric facility. In those days, nobody would have dared do private practice because it was not okay. We felt the need, one of our initial goals was to incorporate, which some 2 years after that first meeting, we incorporated at the Library of Lincoln Center. And immediately we realized that we needed to form a registry. The first work we did was to look toward eventual certification and licensure of dance therapists nationwide, but we knew that that was a very forward-looking trajectory. The development of the registry paralleled the enlargement of membership, and I think that's really important because in 1966, there were only 74 charter members. And as you know, today, we have a very large body of membership by comparison. The development of the registry was always controversial from the very beginning. Many of our members of the new ADTA did not want a registry because they didn't have a degree of any kind. But they did want some kind of recognition because people wanted employment. That was a very big issue in the beginning. In 1972, when I was president of the ADTA, a group of students actually protested the idea of the registry. It was seen as a threat to change. But we all knew on the board that this was a vital decision. And so the board sent out another questionnaire and we got consensus that people did want a registry. And so then in 1971, the registry was begun and it was dance therapy registered, dance therapists registered. And this was a very important step. There could be financial reward now, and we could say that as dance therapists, we had something unique to offer the community. It was only in 1984 that we moved to a 2-level registry of ADTR. Now, this movement happened because between 1971 and 84, guess what? We developed graduate programs. Wow, we were part of the academic scene for the first time, and that was very, very rigorous work, let me tell you, to suddenly move into academia. But it happened. Then we realized that we needed to call ourselves something more significant than just DTR after our names. So it became the Academy of Dance Movement Therapists. That was in 1984. We had a registry committee which actually evaluated people who had gone through approved graduate programs and were now ready to be ADTRs. That was a very, very good move and one that benefited us greatly. There was a bylaw change, and for that reason, we now had this 2-step committee and also a 2-step registry that served us well until we came to certification. Thank you for listening.
Thank you, Beth. And now we'll hear from Stacy McGinn-Hurst, Chair of the R-DMT Committee of the DMTCB.
Thanks, everybody. I'm really happy to be a part of this. I appreciate the invitation. I am going to talk about the certification process, the rationale, purpose, and benefits. And I thought about this, that I should probably context this whole thing even before I get started on this first slide, because as Beth laid everything out for us, you know, the registry was really very pioneering, and even as it transformed itself into this two-tier process, really way ahead of itself, because the ADTR was already such a rigorous process in and of itself. So from a historical perspective, as I was looking through some notes and some papers, specifically the one that was written by Julie Miller and Linda Ehrencourt and Alyssa White, ADTA Credentials, Past, Present, and Future. I would encourage you to read that to give you even more detail of the history. People were actually discussing the possibility of certification since 1980, well before I even thought about becoming a dance therapist. So they really were pushing the idea of certification for quite some time. And there were many reasons that are outlined in that paper that you could have a look at why it didn't take off for a while. And one very specific one was the kind of nature of the beast for getting an examination together. And that was a major obstacle, which years later became not an obstacle anymore because of our portfolio review was now an okay standard by whoever standardizes that. So it really has been talked about for a very long time. And when I joined the board in 2004, Leslie Armanox was on her way out, and she left with this passionate request that we consider changing the credentials from registry to certification. And at that point, it sounded like such an easy thing to do that I raised my naive hand and said, I'll do it, I'll help, and was nominated to come on to that committee. And it only took 8 more years after that for it to get fully actualized, because this board worked so hard to, you know, uncover every single rock and stone and make sure our membership was going to be really safe in this quite monstrous shift that had to happen. And it had to happen on so many levels. So I really think it's important to kind of context this as I enter into the rationale for why we actually did this, when we did this. And Julie mentioned one of the things she talked about was registry by definition didn't really capture what we were already doing. And as Beth pointed out, in 1984, they had this standard, this ADTR, that we are actually still using. Some of the very ways that they reviewed people back then, we're still using today. But we were calling ourselves a registry and not a certification. That was one of the main reasons I wanted to join, was because it just, it wasn't putting us where we were really meant to be, the standard. It wasn't reflecting it for us. So certification, by definition, is exactly what we had been doing. So we made it be kind of, we owned it, basically. I think Julie even mentioned this part too, that from a public perspective, certification is a higher standard. And also from a legal perspective, it's actually the highest standard that you can hold at a national level. So that was another reason. Another reason was to align ourselves with the other creative arts therapists who already had this certification process in place, and many of which have 2-tiered processes. The credential didn't line up with what we call ourselves, dance movement therapists. The credential ADTR doesn't have the word movement in it. So when we brainstormed credentials for ourselves, we purposefully put it as BC-DMT to capture the word movement. Lastly, one of the big pushes from Leslie at that time was that we thought that we could support those who were not able to get licensed in their state, that if they were able to get certified, board certified by the ADTA at a national level, that their ability to get licensed would be improved. So that was extremely important, and one very important reason. Okay, the purpose, and Julie mentioned this before as well, is to protect the public. This board certification is not just handed out to anyone. As all of you know who hold your board certification, it was quite the process. So we protect the public by having these standards to move through. Another purpose was that, again, like I said before, to be on par with other creative arts therapists and to have our profession at the highest level standard it could be at the national level. And my last slide is, what are the benefits that we receive, both as an individual and as a field? So again, I feel like I'm reiterating myself, but it puts us on this even playing field with other people that are at the same level as us. Certification actually holds a value. The term holds a value. When one gets their R-DMT now, it sets you on a course for professionalism towards your BC-DMT. It's like sets your path in front of you to become a professional. And Julie mentioned the professional identity piece. The next one is the process of applying for certification. In and of itself, I think is really beneficial and educational, as you having to write those papers and really dig into your own theoretical framework and those session reports. And lastly, it benefits the supervisor and the supervisee because it gives them an opportunity to wrestle together, to keep learning together and supporting each other as they, you know, as we all together evolve this profession we call dance movement therapy. Thanks, everyone.
Thank you, Stacy.
With another little historical tidbit, which is that I came on the board the year that Stacy was making her final push to get the ADTA to move to certification. And I'll never forget sitting at this board table and hearing Stacy say, "Come on, ladies, let's do this." And they did. So I'm going to talk a little bit now about what happened when we went to certification, because one of the reasons, one of the differences in certification is that it's provided by an outside board. And so at that time, we agreed to split the boards and take what was then the Credentials Committee and move it into a separate board called the Dance Movement Therapy Certification Board. That was in 2010. And the reason that they created this board was that we needed a separate regulatory body that was empowered to confer and regulate credentials for our profession. With the separation of the two boards, the ADTA remained a service organization. And the service organization's primary function is to provide services and support to its members, such as the journal and our wonderful annual conferences, the newsletter, this webinar, and also to provide support to members around the country. The DMTCB, on the other hand, became simply a regulatory organization, and that the function of a regulatory organization is to create an assessment process that could be handled cleanly with no appearance of personal or preferential treatment of certificants. You know, obviously, when we were part of the ADTA, we were members and the work was being promulgated on other members. So this made it a separate entity. These membership and credentials functions have remained separate processes, but most certificants are part of the ADTA. And since we had these two separate boards, there was a lot of concern in the beginning when we were thinking of separating them, based on some things that happened in other professional organizations, that the new board would go rogue, would alter some of the value of the service marks that were developed by the ADTA or change the standards. And so in order to protect them, they set up set up a really ingenious system in which the credentials, the R-DMT and the BC-DMT, were owned by the ADTA and administered by the DMTCB. This ensured that all parties would work together to uphold the standards for professional practice. So we collaborate on all aspects of the standards and procedures involved in the assessment process in terms of creating them, maintaining them, but the members of the DMTCB, are only involved in regulating them. And to ensure that there is an ongoing collaboration, about a year into the process, I think it was Linda Ehrencourt, the second chair, asked for an ongoing inter-board meeting where members of both boards would meet once a quarter. And that included Margaret, the president, and the chairs of education and approvals, and myself as chair of the DMTCB. So we meet once a quarter and we just go over any of the issues that are coming up on either side, on either board, and look at ways that we can revise the process to make it more workable for our members. And in addition to that, I have been working with Joan Wittig, who's chair of Standards and Ethics, to develop a joint response to ethics violations. So, as you know, when we created the certification process, and as Stacy said, we also changed the service marks for the credential. The DTR became the R-DMT, as she described the reasons for that, and the ADTR became the BC-DMT. The R-DMT acknowledges the attainment of a basic level of competence in dance movement therapy. And that's achieved through a completion of dance movement therapy education and training. The R-DMT signifies both the first level of entry into the profession and the individual's preparedness for employment as a dance movement therapist within a clinical and/or educational setting. And that's the definition that's in all of our documents and on the web. The BC-DMT acknowledges the attainment of the advanced board certified level of dance movement therapy practice. It signifies both advanced professional attainment and the individual's preparedness to provide supervision and training in dance movement therapy and engage in private practice. Later on in the webinar, we're going to talk a little bit about the changes as we move into the future. Both the definition and the process to attain each of these credentials has stayed, as Beth said, pretty much the same from the time that they were developed. And it became clear to me when I took over the DMTCB that the time was right to really address some of the issues in light of the current employment and cultural systems that are in place to revise some of those requirements. And of course, as we know, the Education Committee took on the R-DMT for the alternate route. Thank you.
Thank you so much, Julie. I want to pause for just a moment. If you do have questions as the webinar progresses, you're welcome to enter them into the comment chat box as a viewer. And at the end of the webinar, as we have time, we may be able to answer some of those. At this point, I would like to introduce Joan Wittig, who is the chairperson for the ADTA Standards and Ethics Committee.
Thank you, Laura, and hello, everyone. I'm really glad to have this opportunity to talk to you a little bit about the role of standard and ethics within our organization and within our community. As stated in our Code of Ethics, the purpose of the code is really threefold. It's to clarify and communicate the standards of professional values and behavior that guide dance movement therapy practice. And it provides a resource that supports dance movement therapists in ethical decision-making. And it provides a reference to standards for use in processing ethical complaints. The role of standard and ethics is really less about enforcing and much more about providing information and clarification to members about standards and practice. We assume that our members who practice outside the code or the standards of the ADTA generally do so by mistake rather than by intention. And in these cases, the Standard and Ethics Committee can provide clarification for members who have questions or concerns. Our most frequent contact with members is through email. So members often email the Standard and Ethics Committee when they have questions about whether a practice that they're engaging in or thinking about engaging in is actually in line with the ethics and the standards of the organization. Members email us with a question, and then someone from the Standard and Ethics Committee responds to the member to have a conversation, either through email or by phone, and we stay in conversation with the member until their question or their concern has been addressed to their satisfaction. So for example, we might get an email that says, my next door neighbor has a friend who's looking for a dance therapist. I have occasionally spoken with this person at parties. Would it be ethical to now become this person's therapist? Or we might get an email that says, I don't have my BC yet. Can I offer a 2-hour workshop at my local yoga studio called Introduction to Dance Movement Therapy? Standard and Ethics would engage with members around these and any questions that get sent to us regarding, is this ethical practice? Another way that we're in contact with members is actually when we become aware of a member or a non-member who's out of compliance. And in those cases, we initiate contact to start a conversation and to offer some clarity around the issue. So for example, we might get an email that says, a person in my town is advertising themselves as a dance movement therapist, but they have no training. Standard and Ethics then contacts this person to let them know that dance movement therapy is actually a profession with specific training, et cetera, et cetera. And we will have a conversation as much as the person at the receiving end is willing to have the conversation. Or we might run across a website where someone is advertising private practice without the proper credentials. Again, Standard and Ethics then initiates contact with the person. We will reach out to be in conversation. And I say conversation because that's really what we want it to be. We find that the conversations that we have help us understand the perspectives of the folks that we're talking to. And that helps us in our ongoing thinking about standards and ethics. So we're really interested in this being a two-way communication rather than just us sending a message and that's the end of it. Most recently, we've had a lot of contact with members who are unclear about the credentials that are required to practice privately, if they also have a license. So the question that is coming up is, can I go into private practice as a dance movement therapist with only an R-DMT if I have a license in a mental health profession? And here is the answer to that question. The American Dance Therapy Association acknowledges the BC-DMT as the required credential for private practice of dance movement therapy, to provide clinical supervision in dance movement therapy and for teaching dance movement therapy coursework beyond the introductory level. So as Julie mentioned, a license to practice a mental health profession such as counseling or social work only covers the provision of that specific mental health profession. No license granting board intends to communicate that now you can do anything now that you have this license. In fact, those license granting boards are very specific and they offer very specific guidelines about what you can do with this license. Dance movement therapy is not a technique. It is its own profession. And therefore, the practice of this profession is governed by our own standards and ethics. And a license in another profession really has nothing to do with the practice of dance movement therapy. That said, the ADTA recognizes that members who have completed requirements for a license in a related mental health profession have acquired knowledge and experience that is going to be valuable in the practice of dance movement therapy. So the DMTCB does allow the use of private practice hours toward earning board certification. In those cases where a dance movement therapist has a license and is working toward their BC, that person can file a letter of intent with the DMTCB stating that they intend to use some private practice hours toward the employment requirement for board certification. 3,640 hours of employment are required. 2,440 private practice hours can be used towards board certification. The remaining 1,200 hours will need to be completed in a setting that meets the requirements as outlined by the DMTCB in the handbook, in the BC-DMT handbook. Additional supervision is also required for anyone using private practice towards board certification, and specific information about the requirements are available through the DMTCB. So I'm hoping that this little bit of information helps clear up some questions. And please, if you have any questions at all about the ADTA standards or what ethical practice is, please feel free to contact the Standard and Ethics Committee. You can email us at ethics@adta.org. Thank you.
Thank you so much, Joan. Now I would like to introduce two people from the Multicultural and Diversity Committee, the chairperson, Dr. Charnay Furcron, who will be followed by Ebony Nichols. So, Dr. Charnay Furcron, thank you.
Good evening. As a dance therapist of color since 1988, would you have ever thought that I felt isolated and alone within the ADTA for years because of the privileged organizational structure and not having colleagues that look like me? However, without a BC-DMT, I realized I was not able to support my non-cultural dominant colleagues who needed the support of a colleague with shared experiences, mutual interests, characteristics, and values. By obtaining my BC-DMT, I'm able to support my colleagues with similar challenges because of our shared experiences. Therefore, I can offer support and resources to my colleagues who have related identity and concerns. As a supervisor, I often find myself dialoguing with students and supervisees about sensitive topics such as race, ethnicity, sexual orientation, and gender. And many of them express feeling uncomfortable talking to a white supervisor about. As we look at the board certification process, diversity is well-reported concern. According to my conversations with my non-dominant colleagues, they often identify these issues as a lack of cultural awareness, sensitivity, and competency. Many colleagues express the need for the certification process to be more culturally conscious and ethnically diverse. Therefore, the certification board must acknowledge and respect our differences within the application process as it relates to the theoretical framework, language, and movement analysis to embrace the changing demographics of the ADTA. By honoring and respecting multiculturalism, our non-dominant members do not feel like they have to sacrifice a part of their identity as a requirement in order to fit in to obtain their BC-DMT. As the DMT certification board restructures to become more sensitive to cultural values, hopefully they will become more aware that the beliefs that what is right may not be universally shared. According to Kemper and Harry, by identifying similar and dissimilar values allows us to better understand cultural diversity and understand our differences. If you are a non-cultural dominant dance therapist and you're considering yourself a leader seeking opportunities to make a positive impact, think about obtaining your BC-DMT so you can support someone who looks like you or who has shared experiences. Additionally, you can support our colleagues to reduce isolation, increase retention among members, as well as increase diversity within the ADTA. With all that being said, be intentional and be the change you want to see.
Thank you, Charnay. We'll now hear from Ebony Nichols.
Hi, everyone. So Shernay spoke about the isolation, lack of support, and need for support. In addition, there are other concerns that we both have experienced and that we have heard from students, DMTs of color, and historically underrepresented members of the MDC. One of the things often discussed is that many students disengage at the education level. There's a lack of culturally affirming theoretical frameworks that appeal to the diverse nature of the students and future DMTs due to how the system of DMT education is approached and taught. When this concern has been brought to the table by students of color and individuals of historically underrepresented communities, they're often told that they should look at what is there, typically LMA or Kestenberg, and apply it to their population. This is problematic because while we are searching for the universality and movement, it often feels that there is a consistent approach to taking what has been created from a privileged, often white perspective and making it fit. This is just one example, but it is incredibly problematic because there is no one size fits all. We are aware that there is a disproportionate lack in psychosocial research and DMT assessment, including underrepresented participants and relevant to underrepresented populations. As a result, limited studies, research, and culturally sensitive interventions exist that are applied to the codified version of DMT. This makes it difficult for many to formulate a theoretical framework according to the BC-DMT guidelines without experiencing a sense of embodied oppression. Now, in the past, these concerns have been highlighted by some and met with some resistance. And so I am happy that we are having the conversation and delving deeper into finding balance. However, some have also expressed that they have chosen not to pursue further credentialing after their education. Not necessarily because they simply did not want to, although some may fall into the category of not wanting to, but because on top of the systems of hierarchy, privilege, frameworks built on systems of racism, historical oppression, bias, verbal and nonverbal, they felt that they could not move further into the DMT community as themselves, and so they chose to disengage. With that acknowledged, there are some potential action steps, some of which was stated by Karen Bradley in the Facebook post that prompted this discussion. So Karen states, evaluate credentials fully from a portfolio, not a checklist. Learn from those who were trained in other countries what the essential skills are and value them. Examine indigenous healing practices and value the inclusion of effective dance movement-based interventions. Work with members to discover the challenges to employment as DMTs in various states, and if the ADTA truly wants to be international, other countries. Support the advocacy efforts of DMTs to affect policy making at the state and federal level. So all of these statements have value, but due to time, I would just say that step one can open the door to many possibilities on how to diversify DMT and the BC-DMT process and expand the DMT community both locally and internationally. With all of that stated, we also understand that it is vital to have some guidelines as a profession. However, the past dynamics around those who are viewing historically underrepresented communities, placing judgments and values on their movement and theoretical frameworks with limited understanding of their cultural perspective and experience can be unsettling. So then the concern becomes who is evaluating and by what standards. There is also an understanding that past structures have been beneficial to some at another point in time. However, if we do not evolve as a profession, we will face extinction. We must find the balance and the essence of what DMT is and make it applicable to the current times and current DMT professionals. So with guidelines that can lessen isolation, minimize harm, and ensure safety, we do need more BC-DMTs of color and historically underrepresented communities that can reflect the diversity of the DMT community, locally and globally. Thank you, everyone.
Thank you, Ebony. So at this point, with all of that information and perspective to think about, I'd like to invite Julie Miller and then Margaret Migliorati to talk about a few of the initiatives and changes that are afoot. So we'll start with Julie Miller.
Thank you, Laura, and thank you, Charnay and Ebony, for being such a good lead into what I'm going to talk about, because I spent a lot of my professional life doing credentials work, first on the credentials committee and now on the DMTCB. And over the last 20 years, I've been constantly reminded of the ways in which this process has not changed radically enough to meet some of the challenges of the 20th century, now the 21st century. And also more recently, with looking at the ways in which our definitions of what is dance therapy have not really widened to take in a fuller range of people. I really wanted to make some changes. And so I proposed that we have a task force to look at the BC-DMT process in two phases. The first phase was to look at the requirements. And the reason for that was because as more people became licensed, it was becoming clear that there were less people interested in getting certified because it took more years and it was much more difficult to get certified in some ways than to get licensed. And excuse me. And so we really wanted to see how we could bring our process in parity with other certification processes and licensure processes. So we assembled the task force, which is continuously growing and changing. And we began our work last year, and last year we really focused on just the requirements, which were what we did was we looked at all the other certification processes and we made a comparison chart looking at the number of hours that required, the number of supervision hours, the places where people could work, and various other criteria, and really recommended some changes, which has gone out in a proposal for comment first, and will be probably brought to both boards for a vote this spring. And we're hoping that we'll be able to make at least this first level of change in the requirements for earning the BC-DMT. But the second more important piece of the process has been the evaluation. The evaluation portfolio of having 2 essays was really developed, as Beth said, in the 1980s, when there were about 1/10 of the number of dance therapists on the planet, many of whom, only a few of whom had actually gone through a graduate training program. In the intervening 40 years, we have grown, we've developed, we've diversified, and our process has not kept up with that. And so this second phase, which is just beginning, really look at the evaluation process, look at the language. Just for example, there was no rubric even mentioning culture and diversity in the essay. So that's how backward facing it was. So we are now assembled a fairly diverse task force, both geographically, racially, age-wise, and we're going to be really starting to hone in on what are the basic principles that values that we as dance therapists might all share? And how do we widen and grow that vision of how dance therapy is accomplished so that it is not just limited to one view? And also, we are looking at the various ways of measuring that and whether our portfolio review measures it accurately or measures enough. And I'm hoping that by the end of next year, we'll have developed some robust changes to that process as well. And I'm very excited about moving forward on this work.
Thank you so much, Julie.
Thanks. Thanks, Julie. Oh, sorry. Go ahead.
Let me bring you on the screen, Margaret.
Bring me on the screen.
Let's hear from Margaret about these other initiatives that are underway.
Okay. So thanks again, Julie. It's a tremendous amount of work that's going into this task force. I agree, it is beyond time. And I think I'm trying to pay attention to the webinar and read some of the questions and comments coming in, which is a little hard for me to do. But I think a lot of what people have been concerned about are the exact things that this task force is looking at. So I feel very heartened by that. I want to highlight just a couple of things of the many, many things that I think are relevant. That could have been a webinar of its own that the board of directors has been working on. First off, my first bullet here has to do with the really significant and tangible commitment the ADTA is making and the board is making to addressing diversity, equity, and inclusion and becoming a more equitable and inclusive organization. This began 10 years ago with Dr. Angela Gray and the development of the Multicultural and Diversity Committee, which woohoo is celebrating their 10-year anniversary at our conference in Montreal. Please come, just a little plug there. And continues. That committee is so vibrant right now with membership and affinity groups. It is one of our most active, engaged, and alive committees within the ADTA. And so that group is continuing to move forward. We are also, sorry, I'm getting the chats coming in, so let me focus here. We are also, as an association and a board, finishing year one of a long-term commitment of an initiative working with a consultant. Her name is Carmen Marshall. Many of you may have met her in our past conference. If not, you hopefully will be meeting her soon. She's a diversity, equity, and inclusion expert who's been working closely with the board, the Multicultural Diversity Committee, other committees, and we're starting to expand out into our entire membership, helping facilitate trainings, reflections, looking at our structures and our systems, which hopefully the plan will be an iterative process, ongoing forever, because our world is always changing, and we always, as dance movement therapists, as a field, need to be reflective on that and change. I'm very excited to announce that Carmen will be conducting a 6-month webinar series that will be free, entitled Conversations from the Edge on Diversity, Equity, and Inclusion. We have just sent out a survey seeking input into topics for that. So our first one will be March 8th, so be on the lookout for more information about that. Those are just a few of the ideas, the initiatives that are taking place under our diversity, equity, and inclusion focus. I also just want to briefly highlight, Julie has talked about the education and alternate route standards. Under Jessica Young, over the past 6 years, we've had a complete overhaul to all of our education and alternate route standards. I'm going to read to you directly how the changes are relevant to this discussion from Jessica. Okay, so if you excuse me, I'm just going to read this piece. The revised standards are framed with an integrated DMT, within an integrated DMT education in which the cultures of the client and therapist are recognized as intersecting with the core competency. offered through DMT curriculum, as well as intersecting with the culture of the institution, program, and faculty. And that this all resides within a particular social context. I know that's a lot of words, but the revised standards require that faculty, supervisors and advisors receive training in cultural competence, humility, and are assessed by students in that competence. So students will be assessing their professors, their instructors on that competence, and that diversity, inclusion, and equity are addressed throughout all aspects of content, curricular content and delivery. It's not a separate add-on. It's not one class, okay? It is integrated into the lens. Furthermore, the standards recognize more diverse forms of dance as dance experience, including popular, street, social, indigenous, traditional, and folk, okay? So these are initiatives over the past 6 years and that continue with this task force that are looking at the systems and the structures that have underpinned our education and our professional competencies to address the issues that we're talking about today. Now that these are in place, a lot of you have asked about international. Now that these are in place, the ADTA is in a position, now that we've kind of cleaned up our standards and updated them, to turn our eye in the next couple of years to international reciprocity. What does it mean to be trained in another country and to want to work in the US, or to be trained in the US and want to work in another country? So that now we are poised to do that next step, which has been, long overdue and people have been asking for. And then the final piece I just want to bring up is the board will be going into strategic planning in April at our biannual meeting. As part of that, hopefully all of you joining us will be receiving surveys asking for your input. Your input and the data from that will directly impact our strategic plan for the next 1 to 5 years, okay? So this is yet another way for you to get your voice, your needs. We are representing the membership, charged with making these decisions, but based on membership input. And so I really hope you do include your input in that. I'd also like to state that our diversity consultant, Carmen Marshall, will be an integral part of our strategic planning. So again, as with our education standards, we will be looking at all of our goals through that lens. Next slide, Laura. Okay. We have thrown a ton of information at you, and there are a ton of questions, which we will probably be able to get to 2 or 3 of. So we wanted to include a slide here to give you emails where you can write for more information. When all else fails and you don't know who to talk to, just email info@adta.org. It will be channeled to the correct person. If you know your question has to do with education, alternate route, your application, the DMT or BC, or continuing education, you have the emails here for asking those direct questions. And I also would like to encourage everybody, another way, this webinar was based on a Facebook discussion, another way to make sure that your voice is getting to the ADTA and the board and the DMTCB is to join the ADTA's Facebook group, and the link is here. Laura, you're gonna have to tell me with this link, can people access this link through the webinar?
I'm realizing that it probably won't work as a live link,
Yeah.
but they can, when we post it for on-demand viewing, we can absolutely put a link there.
Well, what I'm also wondering is, can we, with the way Registry, and everybody please excuse us because this is part of being a pilot as we work out the kinks here and the logistics. With this being, with people registering, are we able to send out the slides and then the links to people's emails?
I will find a way to do that.
Okay. All right, so so we're going to find a way to do that, which is exciting. If for some reason it never makes it to you, please info@adta.org or email Laura directly at ce@adta.org. And also this link to this Facebook group is the, Angie's wanting me to specify, our PR chair is wanting me to specify. This is the public Facebook group you ask to join, and then once you join, you're able to post and have conversations in this group. Okay.
Well, we have a lot of questions. So
See that.
I think we should perhaps, I'm looking at the questions that have been posted to the Zoom chat, and I will try to pull up a few here. And then I think any board member or any panelist, I should say, who feels qualified to speak to it, give me a little nonverbal signal and I'll put you on camera. One of the themes that is coming up in questions is wondering about licensure as a dance movement therapist. There's some questions about the license that was being, or is being pursued in New Jersey, and are there any efforts by the ADTA about trying to get licensure state to state or on some sort of national level? Perhaps that could be flushed out a little bit.
I think it's Margaret, and I can just jump in very quickly, and then anybody else can jump in. Regarding a national license, so doctors don't have a national license. It's highly unlikely that dance therapists would ever be successful in getting a national license. So that does make it a state-by-state issue. It is, and you know, I know we have some folks from New Jersey on this call, and we also have our Government Affairs Chair, Kristen Pollack, who is at Government Affairs at ADTA.org, by the way. It is a multiple year process to get a license in a state, and it really requires a strong contingency of dance movement therapists in that state. Nationally, we can support that, but a state does not care about a national association coming in and wanting to create a license. It really has to be initiated and held by a group of state members, ADTA or dance movement therapists who want to create a license and are doing it from the ground up because they are the constituents in that state. Our role nationally in that is to provide whatever resources and supports we can through our Government Affairs Committee and our full board. So that's my really quick answer. If you are interested and want to learn a little bit more about what it takes, and I hope many of you are, to create a license in your state, please reach out to that info email or governmentaffairs@adta.org, because it's an incredibly long conversation and requires more time.
Thank you, Margaret. There's a question here, it was asked a little bit ago, and I believe Joan addressed it to some extent, but perhaps Joan, if you could go into more depth. The question was asked, if you cannot practice privately as a dance movement therapist without your BC-DMT, how does that get enforced? Who enforces that? If you're a person who's seeing that take place where someone has their R-DMT and they are in private practice, what's the protocol for that?
Sure, I can say some things about that. I mean, the first thing that I want to say is that everybody who has an R-DMT or a BC-DMT has signed an agreement to abide by the Code of Ethics of the ADTA. And in the Code of Ethics, it specifies that you practice with the appropriate credentials. So everyone who has a credential from the ADTA has agreed that they will operate under our standards and ethics. And so anyone who is practicing privately without their BC is operating outside of those standards and ethics that you have actually agreed to abide by. So the first step is just to remind everybody that, as a member of the organization, you have agreed to be in support of these ethics. And as I said earlier, it is my belief that most people who operate outside of the code of ethics do so, it's a mistake. It's not intentional. So if it comes to anyone's attention that someone is practicing without the appropriate credential, there's a couple things you can do. You can contact the person yourself, especially if it's someone that you know, but you can also always email the Standard and Ethics Committee. Again, that's ethics@adta.org, and we'll get in touch with the person. And, you know, generally when I look at people's websites, I'm able to get in touch and say, wow, it looks like you're doing amazing work. And are you aware that in order to actually practice dance therapy privately, you need your BC credential? And I'm hoping that we cleared some of this up tonight, because I think that there is some confusion. If I have a license that says I can practice privately, why is the ADTA saying that I can't? And hopefully we cleared that up, you know, in really differentiating dance movement therapy as a very specific profession with our own standards. That said, there's no way that we can really and truly enforce this. All we can do is contact people, make sure they understand if they're practicing outside of the code of ethics, but we don't really have a legal recourse. We're really just asking members of our committee to operate within the agreements that our committee have developed over the years.
Joan, there is but there is a recourse in terms of potentially credentials.
Yes, yeah, there is. Yeah, so I didn't say that. So you can always contact the ethics committee with questions, but you can also, if you feel like you want to actually file a complaint, an ethical complaint about someone, there are two ways to do that. And one is an informal complaint, and the other is to file a formal complaint. And when informal complaints are filed, there's a process of mediation. But when formal complaints are filed, this, as Julie mentioned, the Standard and Ethics Committee and the DMTCB are working towards a joint investigation, and possibly someone's credentials could be revoked depending on the seriousness of the ethical complaint. So but that is an option to members and non-members to actually file an ethical complaint, which will then be investigated and action will be taken based on the findings.
Thank you, Joan.
Sure.
Can I jump in for a hot second?
We'll put you on camera, Stacy.
Thanks.
There you go.
I'm trying to do what Margaret was trying to do and double down and read these posts simultaneously. I do think it is getting a little bit confusing, because while Joan is definitely saying what she's saying, there's also that if you're an R-DMT and you're practicing in a private practice with a license in your state, you can create a letter of intention, submit it to the board, the DMTCB, and say you would like to start accruing hours in your private practice towards your BC-DMT. So there is that caveat to comment on Lisa Flatiger at age 17. And I think I saw it a few more times before that too. Did I say that correctly?
Yes, that's correct. And just to follow up, the DMTCB is sort of the board of last resort. If there is a member who has been notified and is, you know, not complying, and a formal complaint comes in, we have a set of very formal case procedures for investigating and making a decision about that complaint that involves a panel of peers to investigate and make a proposal, and then that may result in either, you know, suspension, revocation, or permanent revocation of the credential. Doesn't happen often, but it could.
Thank you. Thank you, Julie. Thank you, Stacy and Joan. There is a question here about wondering why the fees are different, the certification annual fee versus the membership fee, specifically asking why is membership so much cheaper? It seems you get more out of being a member than being registered. So I know that a few years ago, it was actually the other way around. So perhaps we could get a little bit of context about why the fees have changed and where these fees actually go and how they support what they support.
Margaret, do you want to take that?
Do you want to start and I'll or I don't have the history as much about when they changed, when that switched. So I can't speak to that as much.
I can speak to the history because I was on the board when that change was made. And what was happening was there was a concern that we were losing members because membership was so expensive. And we really began to look at how membership should be the thing that is available to all, because it's a membership organization and we want to encourage membership and be in support of dance therapists around the country. So one of the ways that we thought to do that would be to lower the membership fees. And I don't exactly remember the year. I'm gonna take a guess that it was like 2002 maybe. And we decided that we would shift the bulk of the fees to credentials. And I guess the second part of the question is around where does the money go? Maybe I'll leave you to talk about where does the money go.
Yeah, so I actually just wanted to say, because I did, as I was reading through, see questions about fees and how fees are set and things of that nature. I will tell folks, and it looks like Robin Cruz is saying the change was in 2009. I will tell folks that the board has very much been looking at fees and is very aware that if people are required to, for instance, have a license to practice at all in their state, and then a credential, okay, and then membership, that this is a lot of money. And the board is actually very aware of that and looking at, well, how can we reduce it and continue operations and the full scope of operations without losing it? And what are some novel ideas? I think somebody said in a comment and wondered about it. And one example is we're talking about, are there fee-based, income-based sliding scales or different novel ideas? I will say I have benchmarked pretty closely our credential and membership fees with our sister CAT organizations, music therapy, art therapy. We are lower than music and art, and all three of us are higher than drama. So that may be no comfort if you can't afford it, and that's not a reason for us not to take it seriously, the financial concerns and the salaries of a traditional DMT, of which I am one also, and all of us are. But I will tell you that the board is very aware of those concerns and taking them seriously, and it'll be part of our strategic planning. So I'll end it at that because I know we're running short on time.
Thank you so much. There's so many rich questions here, and I did try to pick some that were thematic so that the bulk of the questions could be addressed in some way by our panelists. But I will also take a look at the transcript, and if there's ways to communicate some of these answers via the Facebook group, on the ADTA Facebook group, we can do it there. Again, we have these email addresses. You're welcome to contact any of these individuals with your very specific questions. And also, if you have other topics that you feel you would like to see addressed more in depth, perhaps in an additional webinar, or to really dive into some of these topics, please let me know that in the course evaluation, in the webinar evaluation, because we will be taking all of that feedback very seriously. So with that, I want to thank our panelists very much for providing your expertise and background and information on these topics. As we're winding down the webinar, do know that as the Zoom window closes, you will be directed to a SurveyMonkey survey with a few questions. Once you've completed that evaluation, we will have that recorded, and the office will be sending you your CE certificate within 14 days. And if you are an ADTA member, as a member benefit, you do get that 1.5 CE certificate for free. So thank you all very much for being with us, being part of our first Zoom webinar. This was a learning experience, definitely for me, but so exciting to be part of this process, bringing our community together and having this conversation. Thank you all, and I wish you a very good evening.